Hey future nurse keys, it's me Rap from rapsnursingnotes.com, and in 5 minutes or less, we're gonna learn about how acute kidney injury happens, what you'd see, and how to manage it. But before we get started, make sure you like, subscribe, and hit that notification bell so that you won't miss a single video when they come out. Alright, let's get started. Acute kidney injury or acute renal failure happens when there is a sudden decrease in kidney function that is potentially reversible. And there are 3 types. 1. There are pre-renal causes, which is anything that interferes with renal perfusion, such as hypovolemia, hemorrhage, extreme dehydration, extreme vasodilation, decreased cardiac output, or pre-renal infections or obstructions like renal artery stenosis. The second type, there are intra-renal causes, which is anything that directly damages the kidneys, and they include direct trauma, prolonged pre-renal states, tubular necrosis, intrarenal obstructions or infections such as glomerulonephritis, pyelonephritis, and nephrotoxic agents. And the third type are post-renal causes, which is anything that involves between the kidneys and the urethral meatus. And they include urinary tract obstructions like from calculi, a tumor, or prostatic hypertrophy, as well as post-renal infections. In any causes of AKI, the kidney's ability to filter out the blood is impaired, so the glomerular filtration rate is decreased, and waste products and toxins would start to build up in the body, and fluid and electrolytes are also imbalanced, as well as the inability to produce hormones from the kidneys would happen. And this is why the signs and symptoms appear. Okay, so let's go over the clinical manifestations. AKI has 3 different phases. The first phase, which is after the onset of injury, is the oliguric phase and is marked with sudden decrease in urine output. And that's less than 400 milliliters of urine volume per day, and this is called oliguria. Since the kidneys are not able to produce urine, fluid builds up in the body and signs of fluid volume overload manifest. So there's going to be increase in blood pressure, general impeding edema, as well as pulmonary edema. For some clients, they don't experience oliguria and will continue to have normal urine output, but other signs and symptoms would still persist, such as electrolyte imbalances, and they happen because the kidneys are not able to regulate them properly. And this may include hyperkalemia, hyperphosphatemia, relative hyponatremia, and hypocalcemia. But worth noting though is hyperkalemia, which may lead to dysrhythmias and cardiac arrest. And since the kidneys are not able to filter out the blood, the client will also have azotemia, which is the buildup of urea in the blood, a nitrogenous waste product of protein metabolism, and will show an increased serum creatinine and increased blood urea nitrogen levels. And this results in uremic symptoms such as anorexia, nausea, vomiting, and pruritus. And the client may also experience lethargy, drowsiness, weakness, muscle twitching, and even seizures. And so after the oliguric phase is the diuretic phase. And during this time, improving kidney function would start to show. So uremic symptoms would start to diminish and level of consciousness would start to improve. The GFR slowly increases and BUN and serum creatinine levels still elevated but gradually decline, and urine production would start to increase in large amounts. And on average, that's about 4 to 5 liters of urine volume per day, and sometimes even more. And because of this, dehydration, hypovolemia, hypotension, and tachycardia may occur, as well as the depletion of some electrolytes like hypokalemia and hyponatremia. And so after this diuretic phase is the recovery phase or the convalescent period. And this whole recovery process may take to a year up to 2 years to complete. And so during this period, lab values steadily returns closer to normal. And that's including the GFR, urine output, BUN and serum creatinine levels, as well as the electrolyte values return back to normal. And memory status and physical strength also back to normal as well. On the side note, AKI may not recover and may progress into chronic kidney disease and eventually ESRD. Okay, before we get to the management part, let me pause this video for a second. But if you find this content valuable in any way, shape, or form, I just want to remind you to please like, share, and subscribe, because this would help my channel so much and it would encourage me to make more videos like these. Alright, so let's get back to the video. Alright, so let's go over the interventions for AKI. Dialysis is needed to correct fluid and electrolyte imbalances. Dialysis also clears the blood of toxins and waste products of protein metabolism. And you want to monitor and report hyperkalemia, which is the most life-threatening of the electrolyte imbalances, and it is seen with tall peaked T waves on the ECG. Other than dialysis, sodium polystyrene sulfonate or K-oxalate may be given to decrease potassium levels. You can also give calcium carbonate as ordered to increase blood calcium levels and decrease blood phosphorus levels. Diuretics such as furosemide are also given to increase urine and waste output. You want to educate the client to restrict fluid and sodium intake during the oliguric phase. And IV fluids may be given during the diuretic phase. And you want to record body weights daily to monitor fluid status. And educate the client to restrict foods high in potassium, including restricting salt substitutes to prevent hyperkalemia. And finally, you want to monitor their vital signs, manifestations of fluid volume overload, their level of consciousness, and blood chemistries such as serum creatinine and BUN levels, and serum electrolyte values. Alright, sweet, so that pretty much wraps it up. And if you made it all the way here, that means you want this so bad. And if you have not done already, please like, subscribe, and hit that notification bell. Also, please write in the comments below what med-surg topic you would like to see next. Okay, again, thank you so much for watching. Keep studying and get that nursing degree. I'll see you in my next video. Peace.